Okay. Okay, I'm ready.
Okay, so if you've read and understood, considering it critical care scenario, please tell me how would you go about manage the nutritional status of this patient now?
Okay, I can give him parenteral nutrition like TB, total parenteral nutrition, or peripheral parenteral nutrition, or enteral feeding by nasovaginal tube or surgical tracheostomy.
Okay, how would you calculate the dose which is required to be given to this patient?
Starting by 10 kilocalorie per kg per day and increase to full need over 4 to 7 days. Yes.
Okay, what are the constituents of the nutrition that you'll be giving to the patient?
You mean complication?
No, constituents, the components, ingredients.
Constituents.
Yes.
Okay, it contain various amount of water, carbohydrate 50%, protein 10%, and lipid 30%. Also, vitamin, trace elements, um, and nitrogen adjusted to patient needs.
All right. Can you tell me what are the different routes by which you can give total parenteral nutrition to the patient?
Either centrally inserted or peripherally inserted central line.
Okay. Other than glucose, what is the next highest energy source which is present in the total parenteral nutrition?
Fat provide 50%. Fats provide 9.1 kilocalorie per kg per day.
Okay, good. Can you tell me what do you understand by the term refeeding syndrome?
Okay, refeeding syndrome, it is metabolic disturbance that occur after feeding a person after prolonged period of starvation or after use of artificial feeding lead to metabolic consequence, including electrolyte disturbance in form of hypokalemia, hypomagnesemia, and hypophosphatemia, and abnormal fluid balance.
Okay. Can you tell me how this refeeding syndrome, how the vicious cycle of this syndrome occurs? What are the steps that are encountered or are present? This
I
prolonged
can
starvation leads to, or
lead
malnutrition leads to, or acts on the muscles. What happens there?
catabolic state.
Yes, and that leads to glycogenolysis. And what's happening? Do you know
Okay,
the
the excess
yes?
okay, the excess glucose from glycogenolysis get poor utilization of excess glucose converted to lipids lead to fatty liver and drained liver function test.
Okay,
Yeah.
not just glucose, it also protein catabolism takes place. Then what
Okay.
happens? Okay, we'll
Can I
come
pass
back
the
to this
question?
later. Yes, we'll come back to this later. Please tell me, if you could give me the indications when a person should be given total parenteral nutrition.
Okay, if there is non-accessible bowel or non-functional bowel like an adhesion or paralytic ileus or inflammatory causes like inflammatory bowel disease or pancreatitis, severe pancreatitis or high output fistula, or other causes like severe head trauma, head and neck tumor, and severe malnutrition.
Okay, how would you ensure that parenteral feeding is being given?
Um, monitor monitor the weight of the patient daily and body mass index at first day and then monthly, and also monitor glucose intolerance and fluid balance. and also by monitoring
Urea,
sodium,
electrolytes,
creatinine,
albumin.
yes, daily, and trace elements like copper and zinc monthly. Also monitor vitamin monthly.
And a liver function test twice weekly. Okay, please tell me, right, how would you assess the nutritional status of a patient? What are the parameters that you'll consider?
By history and examination,
Good. And
body mass index and arm circumference.
yes, and comorbidities. Okay.
Comorbidity.
Right. What are the signs of malnutrition that you would observe in a patient?
Okay, sign of severe malnutrition, including body mass index less than 18.5.
No. Not severe. I just said malnutrition. So it doesn't have to be severe. So what are the parameters that you'll consider as a physician, as a surgeon? Poor wound healing, right? Low albumin level and okay, hyperkalemia and decreased cuff reflex. All right, please tell me what should be the normal nitrogen level required by a healthy human being?
I can pause the question.
Okay, please tell me, right, what are the complications that can occur by if you are just giving total parenteral nutrition to a patient?
Okay, there is a central line complication
Okay,
related to central line like trauma to nearby structure, including carotid artery and the pleura, and also infection to central line,
yes,
arrhythmia and air embolism, and there is metabolic complication include hyper or hypoglycemia,
right.
uh, hyperchloremic metabolic acidosis, feeding syndrome, and electrolyte imbalance in form of hypokalemia and hypercalcemia.
Yes, and the mechanical complications that can occur? Prolonged
To
giving of total parenteral nutrition can lead to fractures, pneumothorax, central line, central vein thrombosis, like there could be cardiac arrhythmias, there could be, yes, many causes. Okay. Right. If a patient has been given total parenteral nutrition for a longer time, how would it affect the mucosa of the bowel?
it decrease mucosal integrity as there is no food pass through the bowel. As food passing through the bowel stimulate release of some hormones that maintain the mucosal integrity, and this lead to loss of cellular adhesion and bacterial translocation.
Yes, so it causes atrophy. All right. What are the disadvantages of giving glucose as the main source of energy? Can you give
Okay.
me 3 examples? 3 disadvantages, sorry.
As the patient is already in a state of hyperglycemia and glucose intolerance, so excess glucose from this lead to converted to lipid in the liver, lead to fatty liver and drained liver function test, and also CO2 from oxidation of glucose lead to respiratory failure and decrease ventilatory need and increase ventilatory support.
Okay. Can you look at this red arrow and tell me what are you looking at, please?
Yes, this is Blaikie circularis. This is a stalk of coin appearance,
Stalk
indicating
of
a small
carnitine.
stalk.
What are the condition in which we come across these sort of x-rays?
Small bowel obstruction,
Yes,
mainly in case due to adhesion due to Crohn's disease.
Crohn's disease. Very good. Okay, thank you. Thank you.